And I call the member for Warringah.
Thank you, Madam Deputy Speaker. I rise to speak on the health impacts of climate change and thank the member for Mackellar for this motion, because for too long we've talked of climate change impacts, but we haven't addressed the very real way in which it will address everyone in our society, our way of life, our communities. Climate change is a health emergency. It will impact our core health determinants: food supply, housing, employment and water security. The World Health Organization has described climate change as the defining issue for public health in the 21st century. The WHO warns that the severity of impacts of climate change on health are increasingly clear and threatens to undermine the last 50 years of improvements in health. I mean, think about that. It is just so stark. The IPCC Special Report on Global Warming 2018 states that if we fail to keep global warming under 2 degrees, water and food security will be at risk and some areas of Australia will likely be uninhabitable. From a global perspective, the WHO says that climate change threatens the essential ingredients of good health: clean air, safe drinking water, nutritious food supply and safe shelter, and could undermine decades of progress. Many of the major health bodies in Australia, including the Australian Medical Association, support policy and practical actions to limit the health effects of climate change. Doctors for the Environment Australia advocate for a health framework in mitigation of climate change risks on health similar to that of the UK. It's quite incredible that in Australia we still don't have a national risk assessment in relation to how exposed our communities are to climate change, and we don't have an adaptation or resilience building plan. Direct mental health impacts also from extreme weather events and disasters, including post-traumatic stress disorder, major depressive order, anxiety, grief and suicidal ideation. Such is the prevalence of climate anxiety that the term eco-anxiety has been coined. A recent survey of 10,000 children and young people aged between 16 and 25 years in 10 countries, including Australia, found that 59% were very or extremely worried about climate change, with 84% saying moderately worried. If in this place we are not here to take care of our children's future, then what are we here for? And so we must address this issue. In a submission to the inquiry into the Climate Change Bill 2020 that I presented, the Climate and Health Alliance and the Australian Council of Social Services identified that the most at risk of experiencing health impacts from climate change are sadly those already experiencing poverty, homelessness, mental illness and pre-existing chronic disease. The government strategy must include a plan for those who are most vulnerable and include consultation with persons with disabilities and their representative groups. We know from 2019-2020 the devastating impact on communities from bushfires, and just this year the devastating impact of floods. That bushfire season saw in Australia a huge reminder of the health threats by climate change, because what we saw was the respiratory impacts and the danger to physical life. This year, with the devastating floods we saw across the East Coast, we saw loss of life. We saw heavy rainfalls and floods contaminate water supplies, jeopardise water security, increasing mosquito-borne diseases and increasing psychological stress in communities. Floods frequently damage power transmission and generation, leaving people without access to refrigeration, the internet for information, and we saw that firsthand all across the coast, the East Coast. Even in Warringah we had a flooding event. The prolonged rain and floods along the east coast of Australia is causing an increase of mould in our homes, and with that comes serious health impacts. Asthma Australia research shows that young children exposed to mould and other allergens appear more likely to develop long-term asthma. So climate change is a health emergency. The increase of extreme weather events in Australia is clearly linked to the disruption of environmental conditions that provide the basis for our physical and mental well-being, impacting the air we breathe, the water we drink, the nutritious food we eat, our homes, our jobs. So I welcome the government's commitment to developing a national climate change health and wellbeing strategy, and I urge the government to outline a timeline, funding arrangements and consultation process. It is a public health priority, but we need to do more. You can't say you are acting and still supporting fossil fuel projects. It's time to change.